Hi everyone. On this occasion of World Diabetes Day, today we have come together to launch Star Health's chronic care programs, namely Diabetes Care Program, Hypertension Care Program and Weight Management Program. We have a distinguished guest today who is a true healthcare hero. He is a leading expert in the field of diabetes management, a tireless advocate for diabetes awareness, and a beacon of hope for those affected by this condition. It's a great honor to have Dr. Murthy with us today for an enriching and informative conversation about diabetes. Dr. Murthy, can you please share a few words before we begin our Q&A session?
Thank you so much for inviting me to be part of your prestigious program. It is indeed an honor and pleasure to be part of this recording and interview. So also because the World Diabetes Day comes up in the next few days.
Okay, so let's start with what is the theme for this year for World Diabetes Day?
Every year there is a theme and the main reason for theme is to focus on certain aspects of diabetes. And the theme for this year is access to diabetes care for everyone.
Okay, and what are the types of diabetes, doctor?
There are many types of diabetes. Important three causes would be, first would be type 1 diabetes.
Okay.
Now type 1 diabetes is diabetes which occurs in children and that is associated with destruction of the pancreas, mainly the beta cells which produce insulin, so making them permanently deficient for life. What happens in them is there is usually a trigger of some viral infection and that causes an autoimmunity to set in. Now what is autoimmunity? Immunity is to fight the body's defense mechanism to fight against external forces like bacteria, virus. Because of this trigger, this starts shooting against itself. So the body's immune system starts destroying the beta cell of the pancreas, causing permanent diabetes. So these children do require insulin for the rest of their life. The major cause of diabetes is that what we call as type 2 diabetes. Previously it was called as adult onset diabetes. The reason is it occurs much later and now because of so many lifestyle changes, we do see them in children, adults as well as adolescents. And in this case, unlike the type 1 diabetes which is insulin deficiency right at the start, they present with insulin resistance. In other words, though insulin is produced in adequate quantity, there is resistance at the level of the muscle, liver and fat. So if you want to give me an analogy, now you have 1 lakh rupees in the bank and you continue to spend 20,000 every month. That 1 lakh would last you for some time. On the other hand, instead of that, if you continue to spend say more than 30 and 40, then within 2-3 months it will get exhausted. Same thing, the body copes up with secreting more insulin. This is called as hyperinsulinemia to overcome the resistance. But at one stage it is not able to cope up with it anymore and it gets exhausted, causing decrease in secretion, and once insulin secretion comes down, it's not able to meet the requirement, then diabetes sets in.
Okay.
And third common would be gestational diabetes, which usually occurs in pregnancy, sometimes transient, sometimes it can continue on. Now what happens is pregnancy, because of various changes, is one of insulin resistance, the hormonal changes. So in someone who's prone to get diabetes, during pregnancy being a stress factor for pancreatic beta cell, it makes them diabetic. So that's gestational diabetes.
Okay. Could you tell us which group of population are more prone to type 2 diabetes?
Now, type 2 diabetes is the most common type of diabetes, which I said mainly in adults, sometimes in adolescent and children. Those who have got a family history of diabetes, say one or both parents are affected, are definitely prone. Second, those who are overweight or obese. Third is those who have got a very erratic lifestyle. Those who do not have good sleep, sleep hygiene is very important. Those who are stressed and are not able to cope up with it. Then, like I told you, pregnancy related diabetes, gestational diabetes, usually transient, but it can go on to permanent diabetes. And pre-diabetes, that is early diabetes or those who are prone. These are the group of people who are prone to get type 2 diabetes.
Doctor, could you tell us what is pre-diabetes and diabetes?
Now, pre-diabetes in simple language would be early diabetes. Now, when we talk about blood sugar, there are arbitrary values. Just like for BP, we have 120 systolic and 80 diastolic. For diabetes in young people, ideal level would be fasting to be around 80 and postprandial 120. But that does not always happen because as age progresses, there is a chance for blood sugar to go up, what we call as dysglycemia. Now, there are certain cutoffs. For example, when we take adults, because we are mainly talking about type 2 diabetes, we will want the blood sugar fasting to be below 100. And after a glucose load, 2 hours postprandial below 140. This is the ideal situation. Now, if the fasting sugar goes above 126 and after a glucose tolerance test, the postprandial sugar goes above 200, that is diabetes. So, in between this is pre-diabetes. In other words, if the blood sugar fasting is between 100 and 126 and postprandial after glucose load is between 140 and 149. In addition to it, a common test which is done is hemoglobin A1C, which is an indication of diabetes control or diabetes sugar levels over 3 months. Below 5.7% is normal. Above 6.5% is diabetes. Between 5.7 and 6.4 is pre-diabetes. So in simple language, it is early diabetes.
Okay. And why is India the diabetes capital of the world?
India, unfortunately, has the dubious distinction of having become the diabetic capital of the world in the last couple of years. For once, we have beaten China, but this is a dubious record. Now, with a population of 144 crores, probably a rough estimate would be that at least 11 crores of people are already diabetic. And more important, 13 to 14 crores of people are pre-diabetic. In other words, people who are in early stage and prone to develop diabetes. Like I told you, pre-diabetes, diabetes are all arbitrary figures. Once your blood sugar is above normal, that itself is not right. So if you see between both this, such a huge number. And the reason India is the diabetic capital is we are genetically prone to develop diabetes because the Indian phenotype is one of thin and fat. Now, why do we say thin? Means though we may be thin, we have excess amount of body fat, and that body fat excess causes insulin resistance. And the main place where body fat occurs is the visceral or the belly fat. That is bad. On the other hand, fat in other areas like in the hip, gluteal region or thigh is not bad. And for every BMI is the indication, body mass index is the indication of body fat, usually calculated from height and weight. Now, for every BMI in Indians, we are more prone for excess body fat compared to the Westerners and Caucasians. That's why if you see, if you have to take a normal cutoff for Indians would be, BMI would be 18.5 to say 22.5 or so. On the other hand, for Caucasians, it's 1 centimeter. And this fat in the midriff, the visceral compartment, where it is deposited in the liver and also around in the pancreas and around the kidney and around the in abdominal cavity and the intestine, causes insulin resistance. So in simple language, we are genetically prone because we have more of excess fat for the BMI, that is for the ideal body weight, and that is in the visceral thing. And two things are important. One is muscle, second is fat. So if we are also trying to lose weight, we should only lose fat, not muscles. But unfortunately, to a large extent, we are also sarcopenic. Sarcopenic means less muscle, because muscle is the one that helps in insulin action and insulin sensitivity. So we are genetically prone, and that mainly is because of excess of fat, especially in the midriff or the belly fat. And to some extent, we are also sarcopenic compared to the Caucasians or the Western. So all this is what makes us prone for type 2 diabetes.
What is the importance of lifestyle modification?
Diabetes, especially type 2 diabetes, is a lifestyle disease. And lifestyle modification is very, very important. Now, people who are prone to get diabetes and who have an erratic lifestyle, they have a very high chance of developing diabetes. Importance is not to put on weight, control at being overweight and reduce fat without becoming obese, increase physical activity. There should be proper sleep hygiene. People should sleep adequately. Then work-life balance should be there. In other words, you should be able to divide between working hours plus relaxation and things. And finally, the most important would be stress, because stress is a word which we never knew till probably 10 or 15 years back. Our ancestors, forefathers, parents, grandparents never talked about stress, but in today's life. So stress is another very important thing. So one has to learn how to manage stress, de-stress stress, take up some hobbies or so. So this is all very important.
Okay. And what is the role of diet, and which is the best diet you think?
Now, diet is very important. At the same time, what we have to realize it that India is a very diverse country. You have lot of ethnic groups, lot of cultural variations. And when we are talking about diet, it is something which we have to follow for the rest of our life. So it should be practical. It is not something for a week or two or so. So depending upon the cultural background and the ethnicity, the diet pattern can be followed. But there are certain basic things of do's and don'ts which is best. The first one should be regular hours. You should have breakfast, lunch, dinner, and something in between. That's important. Next is, what has to be avoided will be simple sugars, sweets, honey or palm sugar, everything they come under this. Then carbonated drinks. Then refined sugars, carbohydrate should be complex, not the refined one. When I say refined, it is the polished one. So cereals as much such should be whole grain with the bran on top, because this has got fiber, nutrition, as well as it doesn't increase the sugar too much. Then healthy vegetables, green vegetable, meat can be lean meat, and processing of food, has to be simple. Most important, avoid processed food which you pick across the store and counter. Same thing, all these so-called health drinks should be avoided. Carbohydrate, like I told you, we restrict. And protein is important, even vegetarians like soya and sprouts, there is enough source of thing. Less fat, say in your milk, which can be used for your curds or coffee, tea or paneer. And fruits permissible if they're diabetic and good control would be those who are high fiber, like apple, guava, pears, papaya, and oranges. And preferably no juices. You take fruits, it should be in the form of pulp, with the pulp, not the plain juices. And any watery drink required, the only thing allowed would be probably tender coconut water or chach, as we call it, watery buttermilk, milk made with skim milk and filtered, and lime juice. So in short, there should be certain factors followed. And as long as these are followed, any cultural thing, any type of diet, whichever, depending upon which part of India are there, finally everything boils down to carbohydrate, protein, as well as fat, macronutrients and vitamins. So this is what is very important.
Okay, on that context, can you tell us if the artificial sweeteners are safe?
Yeah, we have artificial sweeteners and there is no problem about them. This is an alternative to sugar and glucose. They have limited or zero calories. We've had plenty of artificial sweeteners which have been available. Things like aspartame, stevia, which is natural from a leaf, as well as sucralose. They've all been found to be safe. Of course, you use it for making, mixing along with your coffee, tea, or what. Not try to make sweet out of it and do other things. And limited quantity up to even 30 grams is safe. So artificial sweeteners are definitely safe. Those who have a sweet tooth, rather than having bitter coffee or tea, they can definitely use within limitation. It's safe.
Is type 2 diabetes preventable, reversible and curable, doctor?
As you know, the dictum in medicine, prevention is the best. So definitely for those who are prone, like with healthy lifestyle, so also with proper diet management and weight control, prevention could be done. Now, early diabetes, like I told you, pre-diabetes, this is where if it is detected by aggressive measures, it is possible for the disease to go into a remission. Remission is inactivity. And to some extent, if weight loss has been more, say you've been able to lose more than 5 to 10%, even remission could last for a long time. Next is early diabetes. Person who has developed clinical diabetes. If in the first few years of life, say within 5 years, there is aggressive treatment and blood sugar normalizes, that legacy effect, when you say legacy, the positive effect of thing, does last for a long time. So in these cases, you could have probably reversal or going into remission for a long time. But once someone has developed diabetes, it means the pancreatic beta cells are to a large extent destroyed. It cannot come back to normal. So cure may not be possible, but pushing them into remission or a transient state or sometimes even longer time of being euglycemic or normal sugar is definitely possible.
Okay. And with the festive season being around, what would your advice be?
Yeah. Some practical tips I can suggest. First and foremost, the human mind is such that, if someone says don't do it or do it this way, it will have a gnawing feeling in their head. So most important, definitely the festival season is around. Relax, enjoy. And as far as food is concerned, the first thing I will suggest, don't go for all these advertised diabetic sweets. They may add on sweeteners, but they are all high calorie sweets, lot of fat. So also, if at all you want to taste sweets, a tip would be take a small piece of sweet, put it in the tip of the tongue. That is where the sweet buds are. And that taste will linger for a long time. One interesting aspect is those days, the kings, have to punish disciples. What they used to do is cut the tip of the tongue. So taste sensation goes off. And without the tip of the tongue, speech also gets affected. So they slur. So, and if you want a simple recipe, now you take, I told you, you should have whole grain cereals, whatever cereal, whether it's rice, wheat, take whole grain, take some skim milk, boil it, and after that, put a sweetener. And you have a very good payasam, like we call it here, or kheer in North India. So important is to cheat the brain. And it is only the tip of the tongue which knows taste. The rear part of the tongue does not really taste. So rather than being saying that you are missing out on something, do indulge in small quantities, not too frequently. And after, the next couple of days, you can go back to strict diet. So rather than going for all this, advertised artificial diabetic sweets, have sweet made at home as long as it's limited. And if you want, like I said, you can make a kheer or a payasam using skim milk and whole grain, whichever is rice, wheat or millets, with the bran on top and sweetness after.
And what is your take-home message, doctor?
So starting with, like I mentioned, it's a lifestyle disease. So proper lifestyle is very important. Maintenance of body weight, less stress, less tension, proper work-life balance, exercise. When I say exercise, it is not only routine exercise, stretching exercise, and muscle, I told you, is important because otherwise people become sarcopenic. Resistant exercise and sleep hygiene, proper sleep pattern, stress management. So this is very important. Diet, as I mentioned, depending upon the cultural background, depending upon ethnic India being a diverse thing, you cannot change patterns. We can't make Tamil Nadu eat chapatis. You can't go up north and say don't take chapati and have rice. You can't change. So within the cultural and ethnic difference, you have to think like basic rules which I said: no sugars, less fat, more proteins, don't go for processed food, and it's preferable that you have food in the whole grain, that is complex carbohydrate, then the so-called refined carbohydrates like maida and all that, and fruits if permitted. Next would be, please take the advice of your doctor. Your doctor, you have to trust him. He is the one who knows your body. He can guide you into what to be done. Please don't go to Dr. Google. Don't go to Dr. WhatsApp. You are going to get confused and it will only make things more difficult for you. And once you have got the crux of it and you know you have to live with it, once you follow all these things, you have no difficulty. And as I told you, early stage of diabetes, pre-diabetes can to be reversed, or the disease can go for remission for a long time. So doing all this is got a reward. And most important, they are all long-term and probably for the rest of life. It's not a quick fix or a shortcut method of a week or a month or 6 months. It has to be followed for the rest of life. And someone should enjoy doing this. Rewards should be plenty, without making it appear that they have been condemned for life and they are suffering. That negative thought should go off, because that itself will stress it.
Okay, and that brings us to the end of this inspiring conversation. Dr. Murthy, thank you for your time, wisdom and dedication to this cause, because it's been a privilege to have you with us today.
Thank you so much. It's been a pleasure to be part of the meeting. I enjoyed being part of this, and I do wish that what we have discussed will be of use to the general public at large.
Okay, and to everyone watching, thank you for joining us on this special occasion today. We wish you a healthy and a diabetes-aware life. And now you will see a little bit about our chronic care programs, and we look forward to you joining our wellness community very soon. Thank you.